Hello, everyone, and welcome to this audio podcast. This audio podcast as part of a Cortical Capacitor. This audio podcast as part of a Cortical Capacitor series or edition. This audio podcast as part of a MaxxaR Pathology. This audio podcast as part of a Storm Robotics production. This audio podcast, this audio podcast, a sort of a sort of an overview and sort of a conclusion and summary to this audio podcast series. So within the existing limitations or limits, for example, around the NHS, the National Health Service in the United Kingdom, and no doubt no doubt in other sort of developed countries and where resources for this kind of activity are not available, but within the context of a sort of a libraries and health partnership development, much might be could be achieved from for the advantage of patients, carers, families, and communities, including the whole professional the whole professional communities, and healthcare professional communities and practices by encouraging sort of the partnerships and inviting patient and public involvement with sort of expertise who can effectively and efficiently add to important discussions. There is a requirement for general practitioners, for example, to enter dialogue with sort of amongst sort of broader services to prompt sort of integrated services between healthcare sectors. Such partnerships would not merely enable an individuals to better understand health and healthcare and treatment, thus realizing the basis around where empowered patients become expert patients, for example, but would also bring together a deeper and public understanding of sort of the interplay in around healthcare, primary care, and around primary care, and sort of and or sort of secondary care healthcare services. The organization involve which is was a basis had a basis in around and sort of from the National Institute of Health Research, or NIHR, had set out a document implementing strategies for diversity and inclusion in around public involvement. A shared decision making partnership should be patient and public patient and public involvement driven, or PPI driven, to ensure sort of where strategy or policy is all inclusive. There is an ongoing requirement or need to support and work in amongst partnership to increase awareness and local services in around and between healthcare sectors, given that more patients and the public will have opportunity to access their healthcare records. A libraries and health partnership can be or could be an enhanced sort of methodology that integrates primary healthcare better, thus allowing all to access health or healthcare related literature using sort of books, leaflets, and digital media in sort of comfortable environs, and in a setting that also has staff that can support in with health literacy and technology. There must be more sort of unilateral thinking to ensure diversity and inclusion of different populations when developing and improving healthcare services. Partnership working can also allow reliable professional help and advice that patients and the public need at a time that suits them and in a language or a format that they can understand and from which that they can learn. An electronic patient record, an MDT initiative, should be supported with library and health partnerships supported with library and health partnerships, and this needs to be sort of prompted or encouraged and sooner rather than further on. That draws this audio podcast to a close. This audio podcast has been part of a cortical capacitor series or edition. This audio podcast as part of a MaxxaR Pathology. This audio podcast as part of a Storm Robotics production.